Hello guys, welcome to my channel. My name is Crystal. This is my first time ever making a video, so bear with me. I'm sorry. I wanted to talk to you about my laparoscopic hysterectomy. I just got 2 days ago. I have 7-8 weeks, so I want to tell you all about my journey 2 days ago and going on forward from now. I'm in pain right now. I just woke up from a nap, so let's talk about the whole thing. I am 34 years old, and like a year ago I started having left ovary pain. I thought it was my left ovary pain, but it wasn't. So I went to my OBGYN doctor and they did an ultrasound. That's where it all started, the ultrasound. So they gave me ultrasound and they said, oh, you have a dermoid cyst. It has fat in it. And I thought that was the problem, because every time I sat down in like any sitting position, anytime I got up and walked, it hurt for a long time, like a year. And finally, I was like, okay, I'll get a hysterectomy, because they also said I had a cyst on my cervix. But that was the case though. So anytime I walked or sat down, it hurt. My left ovary pain, it felt like it was my left ovary that hurt. It hurt all the time, all the time. So I decided, okay, what's going on? So I got an ultrasound, and they said there was a cyst on it. They said I had a cyst on my ovary that was 2 centimeters and a cyst on my cervix. And I bled all the time for at least 2 years. I have a Nexplanon in my arm still. He's going to take it out soon. Oh, let's see. Sorry guys, I'm all over the place. This is my first video. I'm kind of nervous. I wrote down some notes for you guys so I can read it to you. So what I packed was overnight bag. I did not need all those things in that bag whatsoever. I packed a robe. I did not use that robe. I packed slippers. I did use the slippers to walk around the hospital. What else did I use? I used mouthwash and a toothbrush. And that's it. So 3 days before surgery, they called me and asked me a lot of questions. They said stop eating at 12 in the morning. I got my surgery February 9th, 2026. Let's see. So I stopped eating at 12 in the morning. I drive to the hospital. Well, my boyfriend drove me to the hospital. We went to admitting. We got checked in. We went upstairs. It was a long wait actually, because 5 people called out and I was so hungry. So we got a room upstairs. They hooked me up to some IVs. Then the anesthesiologist came. The nurse came. My doctor that was going to do the surgery came. That did my surgery came. I signed a lot of paperwork. What else? And then finally they wished me away. Like, took all my clothes, of course, put it in the bag, wrote down everything I had me sign a form saying what was in my bag and stuff. And when I went into the operating room, it was so cold in there, so cold. And it went pretty fast. He put the mask on me and I was out. And when I came out of it, they put me in recovery for like 2 hours. No one could visit me until I went upstairs and got my own room. I was so out of it. And that night, the first night at the hospital, was horrible. Someone came in like at least every 2 hours to check my blood pressure, give me more IVs, give me antibiotics, check if I was okay. What else do they do? I had my own nurse. His name was David. He was awesome. He worked 7 p.m. to 7 a.m. So he was always checking on me. When I clicked the nurse button, someone always came. And there was an alarm. Every time you get out of bed, the alarm will go off. So they know if you're trying to get up. But they really encourage you to walk. Walk, walk, walk. Because they fill you up with air. And I'm so bloated right now. That's why I can barely talk. I'm still bloated. Whew. So I got my surgery February 9th. Because they had a cancellation. I had to rush and get everything done. I had to get blood work done. A chest x-ray. An EKG. I said get blood already. And I had to make sure everything was right with my primary doctor. After they got all the results back, they sent that to my doctor and signed off on it. Said everything's fine and I'm ready for surgery. And that was very awesome. I've been waiting. I was on the wait list for 6 months. I think the lady canceled her appointment because it was close to Valentine's Day. I was like, I'll take it, February 9th, okay. I've been waiting this long. I want to get in there. So I was rushing to get everything done, chest x-ray and everything. My surgery was at 11 in the morning. I had to be there at 9 in the morning. But it was crazy because 5 people called out and my surgery was not until 6 p.m. Yes, 6 p.m. I was so hungry. It was because there was only one doctor and 5 people called out, so they can only work out of one room. So it took forever, and I was the 5th patient, the 5th hysterectomy, and they were barely on number 2 at 11 a.m., my surgery time. And it took 1 hour 30 minutes for each surgery, supposedly. So my surgery was at 6 p.m. I got out at 8 p.m. They put me in recovery. I was so out of it. And then they already had a room for me upstairs, I think. So I got my own room. It was late at that time. I didn't come to till like 10 because I threw up. I was so nauseous. I threw up a little bit and they put a catheter in me. There was a catheter in me and I did not know that. I forgot. And I had an IV in. I never had a catheter. That was so weird. I had my gallbladder removed. But this surgery was nothing like this. I did not have the catheter. And I went home like in 3 hours. So my nurse had to put a catheter in me. That was during when I was sleeping on the x-ray. I'm on x-ray table. On the table. I have a little bruising on my arm. Let me show you. Hold on. A little bruising from the blood pressure machine. So they said I was going to stay 1 to 3 nights. I got my surgery at 6 p.m. that night, and I went home at 2 p.m. the next day because I was already walking. They really want you to get up and walk so all the bloating will go away. They wanted me to fart and poop, which I could not do that. It was so painful. Walking around was okay I got up and walked at like 12 p.m. because I was so bloated and I couldn't take it. Being bloated was no joke. So after surgery, I ate pudding right away because I was so hungry, and I ate some ice chips. My nurse David's like, take it easy, take it easy. I was like, I'm so hungry. And I really paid the price for that. I ate the whole thing like in 5 minutes. Instantly, I got bloated. He's like, okay, are you able to get up and walk? We'll help you a little. I was like, fine, let's get up and walk. So we walked around the little circle thing in that side. It didn't really help. I was still bloated. And so he gave me 10 milligrams of Norco to help with the pain. I had to use a gait belt because I couldn't, they wouldn't let me walk alone, of course. That night, I probably got 3 hours of sleep. It was so loud from patients moaning and groaning and crying. They were all in pain like me. And it was so weird having a catheter in. I didn't like having a catheter in. And I didn't even know I was peeing the whole time. I was like, how do I pee? But anyway. So I got a laparoscopic hysterectomy. The ultrasounds, I was believing for 3 months. They said I had a cyst on my left ovary. So when my surgeon went in, he did not see a cyst on my ovary, which was very surprising. He said sometimes the ultrasounds have like a shadow and it lies, but he checked both of my ovaries and they were good. He took pictures and everything. He said they were good. Maybe it was something else, like my uterus, that was causing the problem. But now I don't feel that pain, so maybe it was the uterus, but we'll see. I was just bleeding so much blood. And I didn't even get to talk to my doctor when I woke up in the morning the next day. He wasn't there, so I had him call me on the phone. They said I could not go home until I peed, which I peed, and poop and fart. I did not poop or fart. I just couldn't. But they said it's okay as long as I got up and walked. I got up and walked 4 times. It was painful. I was slow, of course. Sorry. I had 3 incisions, one in the middle of my belly button and one on the left of my stomach and right. I'll show you guys later. I am so winded. I'm so bloated. I thought I was supposed to be on like a special diet, but my doctor said I can eat whatever I want, but I've still been eating and drinking like broths and jello and crackers just to take it easy on my stomach. So last night I got home. But I ate like a couple bites of chicken noodle soup and that was it. I was in pain a lot from the car ride here because we lived 2 hours away from the hospital. I live in California and my surgery was in Los Angeles. So it was quite a drive. Yeah, last night I got home, I ate, and I went to sleep. And I woke up at 9 a.m. today, the second day home. I was in pain. I'm still in pain. It hurts. Oh, wow. It hurt when I woke up. So I told my boyfriend, I need something. So he ran to the store and got me some Gas X. It worked like less than an hour. Then I started farting. I was like, yes. I was like, ow, it hurts so much to fart. It hurts. Oh gosh, it hurts. But it helped my stomach. My stomach feels a little better now. And I took a stool softener because I could not poop. I just feel like it hurts, like I'm bloated. I don't know. Am I gonna throw up or poop? I don't know. So I took a stool softener. And it worked within like an hour. And my stomach feels a little better. I still try and get up every 2 hours to walk, to still move all the gas out of my stomach. I just feel really bloated and short of breath. Very, very bloated. Being bloated hurts way more than the surgery incisions for sure. And getting up and down from the couch hurts a lot. When I walk, it hurts. I take it easy. It feels like I'm carrying around a sack of potatoes around my waist. I don't know how to explain it. It's just achy. And my throat hurts because they put a breathing tube down there and it's kind of like swollen. That's why it hurts. It hurts. And my ribs, it feels like someone was punching me in my ribs all night. I'm so sore. It's so sore. It's like hard to breathe sometimes. That's why I try to get up and walk to move all the gas. My doctor gave me 400 milligrams of ibuprofen. I've been taking that. That's helped. What else? I bought this pillow for my back on the couch. It works. You guys need to get this before surgery. And I bought this on Amazon. It's for the car ride home. It works so well. You can put ice back. Oh, it goes like this. You put your legs like this and just wrap it around. It's ringy. And you put your hands, oh sorry guys. You put your hands in here while you drive. Well, you drive home. You're in the passenger seat. So it goes like this. It worked. A lot of pillows. And this is my overnight bag, which I did not need as much as I thought. And this is my cane. I got on Amazon as well. I use it. I'm in pain. It hurts to walk. Oh my gosh. It was just pretty amazing to me because I thought I had a cyst on my left ovary this whole time. And there was no cyst on my ovary. Both my ovaries are fine. He said it was just probably my uterus causing the pain. You know, like it travels. I don't know. But I'm pretty sure the pain's gone. I just keep thinking, oh my gosh, I still have a cyst on my ovary. You know, just all in my head. Sorry, I'm winded again. That took a lot out of me just showing you guys that. But yes, stool softeners are your best friend, and I only took 2 of these and I feel a little better. But walking is key. Walking is your best friend. My doctor says walk, walk, walk. No more bloating. It'll make you fart. You'll feel better. My throat hurts. Oh, my throat hurts. Drink warm things. I made this channel because I see there's not a lot of stories lately about laparoscopic hysterectomies. So my surgeon left 2 of my ovaries and he took everything else out. He took my cervix, uterus, fallopian tubes, all out. I don't have those anymore. So no more periods, no more bleeding until menopause.